Welcome to True Health Tuesday, and the truth will set you free. The truth in psycho world. Okay, let's go over this. We're going to go over the best defense is for any kind of virus. And since some of my stuff is getting wiped off, I have a solution to beat the algorithm. If I say this, what do you think I'm talking about? So this works for every virus, including pray as though everything depended on God and work as though everything depends on you. Where did people lose their faith? In God and mankind. Honest to God, that's what it actually is. I mean, I remember seeing pictures and movies of people praying with bombs going off and everything, because, you know, that's where you're looking for support. And then you hear about Lincoln. He says, sometimes I've been driven to my knees because that's the only place I had to go. And now they're saying all the churches, all the synagogues, all the mosques, everybody can't meet. And they're saying, you're right, we're going to go along with authority. I mean, I understand that, you know, render to Caesar's what Caesar's, you know, that just makes sense financially. Best defense is for any disease. And that includes any disease. No algorithm will get this. Let's look at what's going on with our world, because pray as though every dependent on God, and work as though everything depends on you. When we look at this, can you imagine if I said a month ago all the churches, synagogues, mosques would close, they wouldn't allow any people in there, and the priests, the imams, the pastors will all go along with it? Wow, it's crazy. So let's look at this. Okay, this is actually coming out of Mexico, which is kind of fun. Okay, to capitalize on fear. Now, you know, we're talking about we insured a toilet paper. Does anyone think that's clever? So the society is radically changing. If anyone thinks that the world is going to go back to normal in a couple of weeks, okay, it's unheard of. Some people are saying a week, some people saying 2 weeks. President Trump is saying stuff like, we don't want the cure to be worse than the disease. Okay, well, I think they've already passed that. So what we're doing, now this is my mom. My mom passed around 10 years ago, and she would have been 95 today, and that is her picture. Now, knowing that these times are ridiculously trying, we're talking, can you imagine like every busboy, waiter, bartender, waitress, okay, in all of Los Angeles, out of work for a month, out of work for a couple of weeks. Now, I'm going to take you back. 1965, my parents got divorced. I was 5 years old. And in that time, my dad ended up going to Skid Row for a couple of years, but my mom was a cocktail waitress. She ended up going to school, learning shorthand, and working in the movie industry. Yeah, looking like that, no shit. Okay, but, you know, can you imagine? Single mom, 4 kids, okay, missing 1 paycheck? It's mind-blowing. So what we're doing, we're helping the Orangewood Foundation, and I recommend if you can help them, fantastic. Okay, if you can help anyone, but just know that the need out there is fantastically great. Now, I got this comment, and I thought it was kind of interesting. It was on one of our videos. I get all the data and facts, but we still need to quarantine so we don't bring it home to our vulnerable. Do you want to be responsible for killing grandma? No. No, you're supposed to say, yeah. No, of course. I mean, that's stupid. I mean, when you look at this, what type of suits do we need to thrive on this planet? Do we have to be afraid of every virus, fungus, bacteria, or pathogen out there? Or have people been thriving on this planet for thousands of years? I mean, you do need certain hats for sun protection. You know, if you're going to float around in space, you need that. But do we really need to watch each person to be afraid of your neighbor? because this fear factor is psychotic. So let's just explore killing grandma. Okay? What are the facts? Who is dying, and what are they dying of, and what are their ages dying? Now, this I pulled this up, I mean, literally Monday, okay, which was yesterday. Now, if you look at this, no deaths occurred among those with mild or even severe symptoms. Okay, but when we look at this, less than 9 years old, nobody died. Now, you hear stories of, no, there was an 18-year-old that died. Okay, did they have a healthy immune system or a weakened immune system? So when you look at this, 10 to 19 years old, and you had a death rate of 0.18%. Now, that means that 99.9% of everybody that got this survived. Now, they're looking at a very, very small group. They're not looking at the overall 16 million people that we have under 18 years old. They're not looking at all of that and all the infectious rate. They're looking at everybody that had proved infection, even though the tests aren't accurate, and those that died out of that group. Now, knowing that 80%, 80 to 85%, it depends on the study, have little to no symptoms. They don't even go to the hospital. So this percentage rate of death would be minuscule if you typed in all of the known possibilities. Okay, does that make sense? So these are just the actual infected people. 20 to 49 years old, you're looking at 99.7%. And again, this is the population that is sick, identified positive, and they're in the hospital, okay? Then you look 50 to 59. Now, I'm 59 for the next couple of weeks. That means if I got it, okay, 98.7% chance that I would be okay. Now, here's the challenge. We have a very sick population, very sick. And so then you look at as age increases, 60 to 69, 3.6% died, 96% are fine. You look at 70 to 79, 92% are fine. And plus 80 years, 85% are fine. Okay, now I know I'm wording it different, but our government is designed to give security and comfort and support the public. Oh, I'm sorry, they're not. They're designed to panic the hell out of you in order to make you make rash decisions so that you will not be thinking for yourself so that you can get on with the world. Now, when we look at these conditions, okay, the case fatality rate, if you have cardiovascular disease, diabetes, chronic respiratory rate, high blood pressure, cancer. So it's really the sickening of the population is what's having a negative response to this. That's why when you see people, and I saw people on Saturday walking along healthy, playing on the beach, doing everything that you normally would do, and I thought, thank God, some normalcy. And then, of course, the government put a stop to that. He's going to close all the parking lots. When exercise and sunlight is good for you, that strengthens the immune system. Fun is good for you. So since I'm talking like this, they censored a few of our videos all on the virus. Now, this is a challenge because I'm putting information out there that's referenced, but evidently it's not going along with the narrative. Now, we have a new site on BitChute, okay? That's BitChute, don't say it together. Okay, and they're also at Extreme Health Academy. Use Bergman 14 to get in there, but we're transferring everything. So when we look at the pattern of this, I got an email and on MedPage today, and the top thing was COVID-19, stay-at-home orders, grim ethics, and National Guard activated. Would anyone want to read that? Yeah, National Guard activated, that's a big deal. So it looks like New York, Illinois, New Jersey, Ohio, Louisiana, California, they're all doing stay-at-home orders to quarantine. Now, since I just read from a list of people that actually got it and the people that died, you're looking at, if you're not going to look at the 80-plus-year-olds, but even if you're looking at the 80-plus-year-olds, you're still talking 85% of those people get along fine. So why don't we look at the people at risk and quarantine them and let the healthy surfers go in and go surfing or bike riding or doing all the other stuff or getting back to work or starting to congregate. But they're not going to do that because that makes too much sense. The $2 trillion stimulus package, boy, you got to have a mental giant running that stuff. Oh, they're not working? We'll just print more money. What does that do to the money in circulation? Nuts. And as of 8 a.m. Monday, okay, the entire case count was at 35,224. That's out of a country of 329 million people. Now, when you look at that, that's the case count. Now, we know that there are up to 80% false positives on the test, so we're not quite sure if everybody had it. But we do know that so far they have 471 deaths so far. Okay, so far. So what are people generally dying of? So this is 427 deaths over the entire length of the epidemic now that started back in December. So when we go to the quick stats, it turns out, and these stats are from 2017, and on average, 7,700 people die every day. On average, 7,700 die every day. Now, you'll see the death rates, it's higher in January and December. Why? Because of higher stress, low vitamin D production, typically lower in the winter because there's going to be more vitamin D and, you know, it's warmer weather. Now, this was taken into account when the Lancet did this article in January 31st when I put it up. And they said, look, this is just a virus. Okay, we don't know whether it was created in the lab. We don't know this or that. Okay, but they were modeling this, that it was going to peak around April and go down. And that still holds true for most of the world. Now, when we look at what's causing all of the deaths in America, you can see this massive pie chart here, and it might be hard for you to see it in the back row, having the 6 feet separation of social distancing that we have in this room. Don't give me that look. Okay, heart disease, cancer, other, huge. That's like 3/4 of it. If you look at that little tiny light blue piece up there, that's influenza and pneumonia. And this has about the same death rate, maybe a little less, little more, but about that. And we are crashing the economy, shutting down the entire country, not for cancer, not for heart disease, but for that thin strip. So when we look at the more about this article, they said the FDA approved a brand new 45-minute test that's going to identify the virus. Does it work? We don't know. It's experimental. Okay, the one that's been around for 40 years is inaccurate around 70 to 80% of the time. So I don't know. I'm really excited about that. They say the hospitals, patients are rising. No kidding. They're going to rise like this because people are in a panic state. If this has the same symptoms as the common cold, and we're just finishing cold season, then you have people out of work, not sure about the future. You turn on the radio or TV, they're going to have a panicked aspect to it. And grim discussions, which scarce ventilators. Mind-blowing. Trump activated the National Guard. No kidding. I've got a buddy that has a store up in Los Angeles, and he was told, let all your staff go, move all the valuables away from the store windows, prepare and hide everything you can. Basically prepare for looting. Okay, and of course the National Guard is activated under the pretense that they just need more hospital beds, or they're bringing ventilators, or they're bringing masks, or whatever. But we've literally had armored personnel carriers in San Diego and Huntington Beach, and that's not unusual for 4th of July parade. It is unusual for March. So let's look at why a disease, at how healthy is our population? Let's find out why our population's at risk. For one, a dramatic rise in hypertension-related death rates, and we're looking at nearly a 30% increase in 10 years. That means that, think of it, if I didn't say this was Americans, And there's a 30% rise in death rates related to high blood pressure. I didn't say it was Americans, okay? I said it was caribou or dolphins. 30% increase in death rates from heart disease in the dolphin population. Would we go in there and give them masks? Tell them to do social distancing? Or would we look at the environment they're in? Of course, we know since back in 2015 that for every one blood pressure drug you take, there's an increased risk of stroke, that we want to raise the issue that despite great advances in the pharmaceutical approach, relying on this approach is going to come at a dear price in people's lives. Are we seeing the end result of this psychosis, of drugging people when they're in a stressed state? The American Heart Association and American College of Cardiology make up their own guidelines. They do. They didn't go along with the Joint National Committee 8, which is supposed to set these guidelines, which sets your blood pressure and your blood pressure and your blood pressure and your blood pressure. Well, it's actually all the same. I know, I'm sure that makes sense. And in fact, the old threshold of 140/90, they changed it to 130/80. The old threshold, 32% of Americans had high blood pressure. Now 46% have high blood pressure. That means half of our American population has high blood pressure. Are they getting the right medications? Don't know, but we do know that for every one blood pressure medication you take, your risk of stroke increases. Now, the current evidence doesn't support an absolute threshold for initiating treatment, whether it's 130 or 140/80. I read this and I was going, wait a second, you're just arbitrarily making a decision that everybody should have the same blood pressure with no data? Then we look at Dr. Orange. 300 medications are known to cause some type of drug-induced lung disease. Drug-induced lung disease. Now, we have the most medicated population the world has ever seen. The average person over 60 is taking 12 prescriptions. I'm not taking any. That means somebody is making it up for me. Okay? And I got to tell you, I've got bags of drugs. We've got drugs on the walls back there in displays that people literally would bring in and say, Doc, I'm not taking these anymore. I feel good. So what are the common symptoms of drug-induced lung dysfunction? Well, on a CT scan, a computer tomography of the chest, it shows ground glass opacities, which is the exact same finding, has the So what's the health of our population like? And again, I'm using stats from 2017, when this crisis was already full-blown. I'm not talking about the corona crisis. Oh shit, I just said it. I'm not talking about this. Okay, I'm talking about the health of the population that's been scooted underneath the rug. What do we got? Heart disease. Now, that is 24% of all deaths in America. Remember, 7,700 die on average every day from this stuff. Malignant neoplasm, so that's one in 4, okay, are going to die of heart disease, but we're not upset with that. Cancer, accidents, chronic lower respiratory disease. Does that mean that these people are medicated or they have unhealthy lungs, or both? Stroke, we know that blood pressure drugs can increase that. Alzheimer's, diabetes, influenza pneumonia. Influenza pneumonia, wait a second. Are these death rates going up or down? Well, let's look at this. It turns out that 8 leading causes increased significantly. So that means that from 2016 to 2017, there's an 8% increase in influenza deaths, a 5.3% in injuries. Suicides are through the roof. Alzheimer's is through the roof. Diabetes, CLRD, stroke, heart disease. So why are all these people getting sick? Well, they are getting their flu shot, aren't they? And this is out of the British Medical Journal, 2018. So this was before this panic. Okay, we're talking about a sick, scared population Now they're a drug-sick, scared population, and then they have to deal with this virus panic. They don't mention negative effects of the vaccine and increased risk of illness from influenza and non-influenza associated or caused by the vaccines. Have you ever heard of the negative vaccine effectiveness on any TV show anywhere? Have you ever heard there's an increased risk of influenza illness and non-influenza associated with the vaccines? Well, we can look at a couple of them. One, Archives of Internal Medicine, 2005. They studied from 1968 to 2001. Flu deaths in the elderly increased in concert with their increasing use of flu vaccines. The more flu vaccines you get, the faster you die. Okay, double-edged sword of annual vaccination because it subverts broad-lasting natural immunity. When we look at this, and this was actually pretty interesting because we know America's going to get hit big with this, okay? Why? Because we have an unhealthy, scared population, and we have a really ineffective medical system. Now, are hospitals free in this country, or are they businesses? Businesses? I think they're businesses, okay? So do they get money for beds that aren't full? No. So our hospitals are already full. Okay, so now when they say massive influx, hell, they got no place to put them. It's a sick population. Hospitals are running as a business. If they have an empty bed, you can't bill for an empty bed. So now that's part of it. So then we're looking, and this is a really brilliant article. Okay, the Italian death rate is up 20% because of coronavirus. Lombardy, a small section, up 80%. And I think, wait a second, because I'm reading this article and he says, daily deaths in China have apparently fallen sharply after climbing sharply and then staying high for a couple of weeks. That diagram, okay, by the Lancet, January 31st, was accurate. And it's interesting because they say that over the last couple of days, of course, they are just the numbers from the last couple of days. So you're looking at this as a massive spike or rise and then going down. So when did this start? So when you go to healthdata.org, okay, and you type in Italy, this is the actual crude death rate of Italy. Now, the way over on the left, that's 1995 or 1950. Yeah, 1950. And then it goes up to 2019 on the end. That bottom part of the hockey stick spike, okay, is actually 2006. So that means the crude death rate in Italy before this epidemic was in what state? That hockey stick spike. So what is killing Italians? Now we know they have a massive debt with the World Bank, okay? We know that they've been in a stressed state economically for a long time, okay? So why are all those Italians dying? Well, let's find out what they're dying from. Would that make sense? Because the virus is going through, it started about the end of November, first part of December in China. Now they're starting to open up roads and businesses and everything in China. So, you know, following that spike and recovery, like all viruses, like all, pandemics that go through our society. And what's the causes of most deaths? When we look at this, and this is going up to 2017, we're seeing, again, a rise in it, lower respiratory tract infections, 49%, heart disease, Alzheimer's, stroke, lung cancer, and those are the standard ones. When we look at USA, again, has a larger or an increase in death rates from heart disease, Alzheimer's, lung cancer, stroke, lower respiratory tract infection, colorectal cancer, kidney disease, diabetes, drug use. And you think, well, what's causing this, right? We have a very sick population, and they actually has what causes it. Heart disease causes heart disease. Okay, lung cancer, again, These are diseases that nobody's looking at a causative factor. Drug use disorders. And if you look at that one chart with that massive blue thing, drug use disorders. That's called the opioid epidemic. Does that mean they're not getting enough drugs? No? Okay, just checking, okay. So where is the immune system in all of this? When we look at this, let's look at how we thrive. Okay, we live our life through the nervous system, and we have an automatic nervous system. One part keeps you alive under stress. That's the sympathetics. The other part regenerates tissue. That's the parasympathetics. So your body is in a rest digest state that cranial and sacral, okay, up here and down here, regenerates tissue, and it's your immune system. The sympathetic is fight or flight, and this is how you live. And I was just telling a patient today, if I stood on your foot, would that put you in stress? And they'd say, yeah, because we were talking about their son who was in extreme stress, okay, from physical, chemical, and emotional stress. Your body responds to this. So let's look at a patient, and this is a typical patient, 69 years old. What's his death rate? If he catches this and is weak in immune system, he has a 96% chance he's going to live. Now, he was taking 5 medications, 2 high blood pressure, a thyroid, an antacid, and a pain reliever. Now we know the non-steroidal pain relievers, non-steroidal anti-inflammatories, weaken the lung function. We know the blood pressure ones increase stroke. The thyroid medications, I'm not going to show you what that does, but it's not really good for you unless you've had an operation on the thyroid. But look at his structure. Does that look healthy? No, this is an extremely stressed person. So what we do is we correct the physical and neurologic stressors. Does that mean that high blood pressure, type 2 diabetes, inflammatory bowel disorder, that all of these could have that underlying problem of some type of sympathetic dominant stress? Absolutely. Now let's look at lung function. Okay, C3, C4, C5 keeps you alive. That means the nerve at the base of the neck supplies the diaphragm. So if you have a neck trauma, a problem, forward head carriage, you went through a windshield. Just had a patient this morning that when he was 15, he went through a windshield. That's not good for you. But if you have a problem up here, that puts your body in a stress state. Let's look at the lungs. You breathe in, that diaphragm comes down and the tummy's got to come out. You breathe out, the diaphragm comes up and forces air out. This is why we recommend the Wim Hof breathing or conscious breathing, because you've got to do that oxygen carbon dioxide transfer. That means that blood's got to go through close to that alveoli, the little air sac, okay, at 1 cell thickness. Now, when we look at viruses, should we be afraid of viruses? British Medical Journal states that viruses are beneficial for asthma. That it's literally don't worry about electronic stuff, hon. I went 10 minutes ready to throw a hammer through it. I know. I got a lot of empathy for you. Okay, so when we look at this, the British Medical Journal, to investigate an association between early childhood infections and subsequent development of asthma. Repeated viral infections, other than lower respiratory tract infections, may reduce the risk of developing asthma. It turns out that you build your immune system through infections, through exposure, and this makes you stronger. I mean, you think of a snot-nosed little kid running around, that's because they're getting all of these different pathogens and building an immune system. You don't see snot-nosed older people because they've already been exposed. We know that antibiotics, okay, increase asthma. So how many people are taking an antibiotic for an ear infection or eating glyphosate-soaked bread? Okay, glyphosate-soaked bread. Okay, that's not that easy. Say that 3 times really fast, okay? Okay, that destroys your gut. That's your immune system. They're antibiotics. Antibiotics in our meat. So we have a completely sick population. No wonder it's altering lung function. And so let's look at what blood is. Because remember, we got lung stuff going on. And that blood has to get down to 1 cell thick to go through that alveoli to do that carbon dioxide oxygen transfer. And you're looking at 2 live blood cell analysis from our clinic in Mexico. Yes, our clinic in Mexico is still open. Yes, our clinic in Huntington Beach is still open until they, close the doors or do something. Okay. Yeah, you don't want a natural health clinic like this open and running to help the population. Okay, so when we look at the one on the left, we're looking for mobility, white cell ratio. We're looking for membrane integrity. That's if we see, good, healthy. So this is the production of blood. Now, blood is changed every 120 days. That blood on the left is really, really hard to hold oxygen. They're clumping together. The blood on the far right, those are separate, distinct. They work. Okay, so you're looking at two states of stress. How many people are misdiagnosed with high blood pressure who have that snake-like worm rouleau coin formation? I mean, it's nuts. Here's one patient that was misdiagnosed with high blood pressure. You're looking at a reverse curve of the neck, a leaky gut, inflammatory responses, dental issues, and really crap blood. So does anybody think that she needs a blood pressure drug, cholesterol drug, type 2 diabetes drug, or we fix her stressors and she's drug-free? This guy, a canola farmer from Canada, that's his blood before on the left. Now, this blood won't be able to filter out to this joint. So what does he have? Diffuse joint pain. I got an idea. We don't need to check that. We'll just give him a non-steroidal anti-inflammatory. Treat him like an American. Okay, that destroys his kidneys, destroys his joints. What about how many people are going to have blood pressure issues like that? It's nuts. This patient here, 55, physical, chemical, and emotional stress. And they were diagnosed, literally diagnosed, okay, with high blood pressure, type 2 diabetes, anxiety, fatigue, sleep problems, low thyroid, adrenal fatigue, inflammatory bowel disease, fibromyalgia, and chronic regional pain syndrome. Did they have any of these conditions? No. They had a reverse curve in the neck, multiple rotational malpositionings, and they were poisoned. The gut, when we're looking at 80% of your immune system, because we're talking about immune system here, 80% of your immune system's in your gut. Okay, now the proton pump inhibitors, and this is something that decreases acid. If you decrease acid in the stomach, and look at our hiatal hernia video, look at our reflux videos, that reflux comes from too little acid. And if you take a little purple pill, you're increasing your risk of cardiac arrhythmias, heart damage, mineral absorption. It's devastating. This one says it increases your risk of adenocarcinomas, which is supposed to be what they're designed to correct. So what causes gut damage? Chronic stress in the nervous system, antibiotics, GMOs, vaccinations, and processed foods. When we look at this, cholesterol drugs. What is cholesterol? Oh my God, it clogs arteries back away. No, it doesn't clog arteries. Why doesn't it clog veins? Cholesterol is a hormone production, estrogen, testosterone, progesterone, aldosterone, cortisol, vitamin D production. It aids in bile production, so you can emulsify fats. But here's the problem. If you give a drug to lower cholesterol, it increases hardening of the arteries and heart failure. I know you have two hearts, so it's not going to concern you. But if those of you who have one heart, thus the epidemic of heart failure, which is one of those 25% things that are killing Americans, and atherosclerosis that plagues the modern world may be paradoxically be aggravated by the pervasive use of statin drugs. Cholesterol-lowering drugs cause dysfunction of the heart muscle, increased plaques of the arteries. So what is all of this? What weakens the immune system? Stress. Physical, chemical, and emotional stress. Medications weaken your immune system. So if you are taking a drug, find a doctor that's going to look at the cause. Nutrient deficiencies. Because if you're taking drugs, you're not producing healthy amounts of stomach acid. This is why we recommend juicing, blending, and whole food supplements. Sedentary lifestyle, you got to move. Except with the social distancing and the shut-in home, and they're saying don't walk on the beach. What idiot comes up with this? Okay, I mean, we heard Governor Newsom say, we know who you are. You're walking on the beach. Really? Really? Cool. Join me. I'll show you how to have fun. So when we put this up, it's so simple. It's so simple, but it's so contrary to the narrative that you're hearing. It's so contrary. So let's go back to the Black Plague, Nostradamus. Ever hear of him? Smart guy, except the medical authorities at the time knew that the disease came from sin and evil spirits. Okay, and so what they would do, there was no known remedy at the time. The doctors relied on potions made of mercury, bloodletting, and dressed the patients in garlic-soaked robes. Now, they also told them, keep all your doors closed, stay in a room, so this is no indoor plumbing, so you're pooping in a bucket and, some servant's taking it away. If you had really good money, because this was top-level care. Nostradamus had some different ideas. Okay, he thought he didn't bleed his patients. He didn't see the sense in doing that. He practiced instead hygiene. He changed their sheets. Remember, this is a hemorrhagic fever, so you got some blood on the sheets. Clean the sheets, remove the infected corpses from the streets. He created a rose pill that was loaded with rich in vitamin C, and his cure rate was impressive. It was so impressive he was actually kicked out of some communities because they thought he was in league with the devil. Because how can the medical authorities at the time, who were the geniuses of our planet, their therapies were ineffective and his natural therapies were effective? Anyone seeing the correlate here? Okay, good. Okay, so how does the immune system work according to massive medical science? Gary Fatham, professor of immunology, we have no idea on how the immune system works. They don't, but we do know the reaction to your body through the autonomic nervous system of physical, chemical, and emotional stress. What is the chair of Stanford University School of Medicine and Immunology? It's staggeringly complex. We don't know how. It's an awful lot of moving parts, and we don't know the vast majority of them do or should be doing. Medical science is guessing at stuff. And we have a very sick population that's listening to these guesses. They're making assumption on top of assumption. They're utilizing this pandemic to change our financial situation, to reset the economy, then to reset the population, because a scared population will give up their rights. They'll give up their rights, and if you give up your right for bodily autonomy, that you sign up for this untested, unproven vaccine, okay, then you have given up your right for bodily autonomy every year. Every time there's a new vaccine, every year, you're going to have to show proof of it. Every adult is going to have to get this. Do not give up your rights for this. Do not give up your rights. When I put this up here, and this is the solution for the common cold, for everything. Why? Because anything that works with the natural body processes is good. Anything that works against it is not good. Does that make sense? Next week, we're going to talk about more cool stuff. Thank you very much.